Hi friends, welcome back to the Holistic Health Podcast. This has been a very requested topic. Do you know that?
I'm not surprised. There is a lot of questions and contention around this and a lot of conflicting advice from different health providers depending on where they stand. So I'm really excited that we're talking about this today. And I just want to preface that by saying we could probably talk about this for 3 hours. I will not be talking about it for 3 hours.
That's correct.
I promise. So there's a lot more we could say about this than we're going to say today, but we're going to just start with 5 tips. And if this is something that people want to hear more on, maybe we'll do a part 2. But these are probably, it's hard to say which ones are the most important, but
we won't do that to you.
No.
You don't have to choose. It's okay.
Okay, thank you.
Deep
I
breaths.
can't pick my favorite children.
No.
Yeah.
And you're right. We won't be going into every element, but I think if you hit the elements that we're sharing, then you're off to a bloody great start.
Yes.
And one thing I just want to specify, it's hopefully obvious, but in case it's not, we're specifically talking about choosing, like helping you choose a prenatal. That doesn't extrapolate to then mean that that is all we would recommend as part of preconception care. It's definitely individual, and also I would say that we get a lot of questions in our DMs, or I know I certainly do, around, well, which prenatal, can you tell me just the one you recommend? And while we are going to give you examples of some of the brands that we clinically recommend fairly frequently in practice, I also feel like I don't want people just to rote learn brands. I want people to understand why they're choosing what they're choosing and what to look out for. So with that in mind, let's just kick off with one of your first tips, or what you would look for in a good quality prenatal.
Okay, so starting with folate, I think this is the one that everyone is interested in. I think because if someone's entering into a prenatal for the first time and hasn't been in the realm of holistic health, the one thing they would have heard of is folic acid. And often I still come across women today who think that's the only thing you need to take. And spoiler alert, it's definitely not. But also I have an issue from a nutritional biochemistry point of view with folic acid. And that's because folic acid is a synthetic molecule that in some people can be converted reasonably well into folate. But the nutrient that is required for optimal brain development and, optimizing the intelligence of the unborn child, as well as DNA methylation and 5 million other things, is actually folate. And it goes through a process of biotransformation, if you like, to then fundamentally play the roles that it plays. So this is going to be something, if you've just arrived on this episode and you're like, here's this prescription folic acid that's a very high dose, this information is going to be a little bit different. And so when it comes to a prenatal, what I look for in this space is either the folate form, which for most people is an excellent choice. Now, there are genetic SNPs that might mean folinic acid or methyl tetrahydrofolate, or 5-MTHF is a better choice. And that's, of course, up to the practitioner who's looking after that person to assess that. But folate is the form that we find in food, and that's the form that is easy for our bodies to metabolize. And generally speaking, a supplement, and it's true for prenatals as it is for every other supplement, is designed to supplement your diet. It's not a replacement. So typically speaking, we would look for something around 500 micrograms. Now that is a lower dose than the dosage of folic acid that is recommended. And I think just to talk to that point for a moment, because the biotransformation of folic acid into folate isn't great, you do have to use higher doses of folic acid to get the result that you would otherwise get with a less dose of folate. And it's a bit tricky to sort of demonstrate that without imagery, but essentially folate half a milligram is a good amount, and you can always just sort of top yourself up nutritionally wise. Of course, there are individual reasons why people might need more, but that is a really solid dose that I would be very comfortable with when it comes to prenatal nutrition. One thing I will say is everyone talks about folate or folic acid more so, because that's in the vernacular, preventing neural tube defects. There's two additional points I want to make about that. Number one, it's not the only nutrient that is required for neural tube development. Choline, which we're going to talk about today, and B12 are equally required for neural tube formation, which means if you have a deficiency in B12 or an insufficiency or choline, you could still end up with neural tube defects, even if your folate or folic acid was great. So that's really important. We are going to touch on choline in this episode, but I also always look for roughly a 1-to-1 ratio with B12. Again, that's very individual. Some women might actually need more B12 or a different form of B12 than typically comes in a prenatal. But generally speaking, and this is true for a multi as well, I'm always looking for that to be taken care of.
Yeah.
So, yeah.
I think that's such a good point. And clinically, we were discussing this actually before we hit record, of just how nuanced that folate need can be. And one of the clinical tools that we use, if you're a practitioner listening or you're a patient listening that can advocate for themselves, is that we often will monitor people's homocysteine levels through, definitely preconception and then through pregnancy, because it is one of the ways we can tell whether or not you have a higher need for higher doses of B9 and B12 as some examples. And that's personally how I fine tune it for someone.
Yes. One other thing I wanted to add to that, thank you for saying that, first of all, because that's such a big issue, and I think that's what's missing in a lot of this conversation around how much you need. But the other thing I meant to mention is at the point that the embryo actually connects to the bloodstream, the neural tube has already closed. So if you start taking a pregnancy multivitamin once you find out you're pregnant, that is not the ideal time to start. The developing blastocyst is nourished by the nutrients onboarded in the egg yolk as the egg develops in the months prior, which is why, in my opinion, preconception care needs to be a minimum of 4 months or 3 months at a push if you want to do it properly. And in that time, you can obviously identify if homocysteine is elevated. There's different ranges. I'd love to hear what you say. Also, low homocysteine is not good either, which means you might need to lower the amount of folate/B9, B12, things that you're taking. But ultimately, you have then got a runway where you can correct the homocysteine and make sure your body is replete in that nutrient and that it's available for the egg to have on board for that development that happens. Because if you start taking it after, it's really the baby's just working with what you had on board prior. So in an ideal scenario, you will do this for several months beforehand.
Yeah. And it's also a reason to just try and be a healthy human as often as you can, because I do think that I've seen it clinically just really pay dividends when there is an unexpected pregnancy.
Yes.
So yeah, definitely you all know we're fans of preconception care. The next tip that I have is very simple, and it's look for an iron-free formula. Now there's a few reasons for this. One, you don't want to take iron if you don't need to take iron, because too much iron is not a good thing. I am one of those people who has too much iron in my system. Not right in this moment, but that is a struggle I have. And it's not as common as being iron deficient in women of menstruating age, but it still is a thing. But even if you are not, even if you don't have excess iron, or you even have adequate iron, even if you needed extra iron in your diet or in your supplement regime, you're far better off having iron as a separate supplement than you are putting it into a multi in that preconception window, because we've spoken about iron supplementation and absorption before. So if you want a more detailed conversation on that, you can look back at previous episodes. But in a nutshell, you absorb iron better if you take it every second day rather than every day. That does change a little bit when you are actually pregnant, just the way that iron behaves in the body changes. And so you can take it every day in that context. But in the context of looking for it as a preconception support, or if you aren't actually iron deficient, it's far better off to look for an iron-free formula. And it's getting easier to find that, but you need to make sure you look, because it's definitely a lot of the really common old school ones that are just in pharmacy. They still have iron in there.
Yes, yeah. It just doesn't allow for the individual requirements at all. You can't dial it up, dial it down, take it out. So, yeah, and too much iron is as problematic as not enough.
Yeah.
Yeah, great point. Well, I was banging on about choline just before, so I may as well give choline its moment in the sun. So choline, as I mentioned, is really important to reduce the risk of neural tube defects, but it plays so many other roles. Like, it's an important part of every cell membrane in our body. Of course, it's very heavily concentrated in the brain, but it also helps to improve nutrient delivery across the placenta, particularly fat-soluble nutrients as well. And so it's a really important nutrient for general health, actually, for humans who are not pregnant. But in the case of pregnancy and for babies, it's really important. And also for maternal health, it reduces the risk of preeclampsia.
Which is high blood pressure.
Which is high blood pressure. Yeah, it's a condition that may occur in pregnancy. There's a few other sort of elements to it. There's a number of things that can feed into it, including, low antioxidant status. There's other nutrients that are really important there too, but choline is a big player. That being said, choline is also one of those things that we need in quite sizable amounts, actually. So in terms of an ideal range for pregnancy, depending on what you're looking at, it could be anywhere from 450 milligrams all the way up to 3,000 milligrams or 3 grams. So it's a chunker, like it's kind of it's a chunker. It's like the fatty equivalent of magnesium. Like, you just need a lot. We just need a lot of it. And when it comes to prenatals, I think Nat you made a very good point at the beginning of the episode. A prenatal is only one part of prenatal nutrient supplementation support, and you actually can't get everything in a prenatal. Essential fatty acids are a really obvious one, but when it comes to choline, there's no way you'll be able to get that upper level of dosage in a prenatal multivitamin, because it's just going to take up too much room and crowd other things out. The other thing too is, again, this is actually something that's quite easy to get from food. Like, eggs is such a really easy place to get it, assuming you can stomach them. First trimester is probably tricky, but later on, when your appetite comes back and the requirements of your baby are much higher, you can easily top yourself up from food. So in a prenatal supplement, a good starting rate would be around 400 milligrams, and anything less than that, I think you could do better. But anything, I wouldn't be expecting more than 500 or 600, because it's just, you're not going to probably get enough of those other things that you really need as well.
Yeah, good point. And yeah, because there is a reality to capsule size.
Yes, there is. It would be a golf ball.
Yeah, logistics of things as well. So I think the next obvious one to me is iodine. Perhaps I'm biased because
You're the thyroid queen.
I do love thyroid health.
Yeah.
And I think this is one of these spaces where it gets so bloody confusing, especially around the conversation of people who have thyroid issues pre-existing. I see this confusion happen all of the time, and it goes in all sorts of directions. So I'll give my 2 cents. There are different opinions out there around it, but as a general sense, I would say iodine dosage range that I'd be looking for in a prenatal, I'd say around 250 micrograms in a prenatal is good. I wouldn't take anything higher than that if you had the presence of thyroid antibodies, just because it is a very fine line between iodine aggravating the immune system in a thyroid autoimmunity situation versus acknowledging the fact that iodine is incredibly beneficial for, brain development in babies. Also, it's really important for thyroid function, because it isn't until about 18 weeks gestation that the baby's thyroid actually is able to do its own job, essentially. Up until that point, all of Bub's thyroid hormone is essentially reliant on the mother, and the mother's thyroid function is somewhat dependent on having adequate iodine on board. Now, you can test iodine levels. It's an imperfect test, which is why you need to look at it not in isolation, but also in association with thyroid patterns of iodine intake. But it is possible. But otherwise, just coming back to the point of the tip, is around 250 micrograms is where I'd be looking for it. If it was slightly higher than that, as in like some of them have around 270 to 300 micrograms, that's fine, and actually could be a really good option for someone that does not have pre-existing thyroid antibodies. And you definitely can go higher than that, like up to about 500 to 600 micrograms. You're very unlikely to see that in a prenatal. That'd be more a situation where you do that under supervision if you needed more, and you'd probably be getting it external to just in a multivitamin. The only reason I'm hesitating of being like you'll never find it in a prenatal is some of the US based like prenatals go pretty high in a lot of different nutrients, and I haven't looked at every single one, which is why I'm saying definitely still check, don't assume, but around that 250 microgram mark is a pretty good place to start.
Well, it's kind of covering close to the RDA, isn't it? So you've kind of got the basics covered, and then anything more you need can be prescribed.
And just be mindful that, because I'm really aware that there are also a lot of superfood based products around now that also have iodine sources in them, like kelp. I'm not saying that that's a bad thing. I'm just saying that nutrients add up. So with nutrients that are Goldilocks nutrients, as in there's a sweet spot for them, like iodine, it's really important that you are making sure that either you're being really thorough yourself, or you've got someone who knows what they're doing that's looking across the board. Because I know it's so tempting and easy to be like, oh, that sounds really good, I need a little bit more of that. Or my energy's been low, maybe I'll get some of that. Or my hair, my skin, my nails, that needs some support. And before you know it, you're OD'd on zinc, on B6, on iodine and selenium, and these are all like Goldilocks nutrients where too much does create an issue. And I've seen people create a thyroid storm or trigger Graves' disease by high dosing iodine from multiple supplement sources, and purely just by not knowing any differently. So I would hate to see that happen to someone, because it's not a fun time. No,
absolutely not. And I think this is probably a wise lesson across the board. I find, I see some clients who are on, have been maybe accumulating things along the way, or self-prescribing multiple things, and they've ended up with far too much of, B6 is an easy example, but there's other examples too where, you can really run into trouble if you're not keeping an eye across what you're taking. Same with vitamin A. Vitamin A, we're not going to touch on that today. It's an essential nutrient in pregnancy, actually, and beta carotene doesn't cut it. However, you can, of course, get too much. And I know beef liver is really popular at the moment. If you're eating animal-based foods and you're taking, say, another supplement with vitamin A in it, you could end up, again, accumulating too much. So it's always wise to have someone check it, or to do the maths, actually consciously do the maths.
Do you like pate?
I do. You don't?
No. I tried, although it's probably not a bad thing that I don't like pate, because I don't need more iron sources. Yeah. How do you like to have it, in case someone's like, I want some more vitamin A in my diet?
Yes. Egg yolks have some, but pate is kind of the biggest payload.
Do you know what I'm thinking? Have you ever seen Shrek? The movie.
Yes.
Donkey goes, everybody love pate.
Everybody
love pate.
except you.
Yeah, except for me.
So I do think it depends on how it's made. Generally, I don't think I've had one that I hate, but yeah, I like it made with like red wine, garlic, bit of
Heavy on the red wine.
Heavy on the red wine, bit of orange peel. Like, yeah, I think I find it really nice.
Yeah.
So yeah.
When I was hardcore, like getting into my health, after I went through a few things. The first thing was I started cracking coconuts with an axe in my backyard because I was like, I only have raw coconut milk that I've homemade from scratch. My mum was like, sweet baby Jesus, stop using the axe over the gas pipeline, because I was cracking it on the tiles and there was a gas pipe underneath.
Oh, wow.
Anyway, obviously I didn't really worry about the details. Anyway, after I got through that phase, and through the phase when I was hardcore paleo and picking peas out of my mum's spaghetti, I actually was doing liver for breakfast, like just stir-fried liver for breakfast. Why? I do not know. I was just desperate.
Far.
You know when you're when you're really unwell, and I'm sure everyone listening, if you've been through a health crisis or maybe you're in one at the moment, you get to a point where your quality of life is so not there that you will do anything.
Yeah.
And I didn't know, I wasn't qualified at this point in time. I didn't know what I know now. And my tolerance for doing random shit has definitely decreased. But I actually look back on that and I go, how did I do that?
I don't know how.
It wasn't even pate. It was
just
cut up
it.
liver, stir-fried.
You didn't even put it into like a spaghetti bolognese?
No,
you just
before 8 a.m. Just stir-fried in a small little pan that you'd heat your eggies up in.
Wow.
In case anyone
I bet that smelled really good in the kitchen too.
And whenever I'm going through something hard, I think back to that time and I go, you can do hard things, girl.
Yes.
You ate stir-fried liver for breakfast before 7 a.m.
Look, I honour your commitment to yourself. That is really impressive, because that is definitely not an easy thing. Yeah, I'd rather be smashing coconuts with an axe. Yeah,
that was a lot more fun. Quite therapeutic. Can recommend.
I bet it was. Yes, a bit like a natural rage room that's nutritious.
Yeah.
Here for it. Thanks. I'd like to try it sometime.
Maybe we can do that as a bit of a somatic release.
Yes.
At some point.
I need this. Yes.
In the next few days,
in the
probably.
next few days would be lovely. Yes.
Imminently.
Yes. Speaking of nervous system regulation, the next nutrient I want to mention is zinc. Nat and I are both members of the Zinc fan club. It is such an incredible nutrient. It's actually a very common deficiency. Everybody knows about magnesium. It's actually the number one nutrient deficiency in children, but it's actually a very I would say it's definitely in the top 5 for adults, maybe even the top 3. And it's important for, again, a bazillion reasons. It's active in over 130 different enzyme systems, but in terms of cellular development and replication, it's crucial. And when you're growing a human, literally 3D printing some biological tissues, zinc is crucial. It also helps with implantation. If you are onto this preconception, it really helps. Zinc is really supportive to ovaries and follicular development and fertility, and is really important in establishing a healthy placenta because of its role, many roles, but because of its role in driving the enzyme that produces collagen and other connective tissues. It's also really important for good tone of the uterus. And one of the number one things that happens with insufficient zinc in pregnancy is stretch marks. Now, it can be because of low vitamin C. It can be an essential fatty acid thing. It's not always zinc, but it often is insufficient zinc. So, and this, just from a physiological point of view, but also just a nervous system point of view, such a key mineral in a prenatal. Now, there are different forms. My favorite, for the most part, is glycinate. But glycine is a very big molecule. And so when it comes to fitting it into a combination of nutrients, picolinate is also amazing. That'd be my next choice, or citrate would also work really well. And again, a prenatal multivitamin is not designed to cover all your bases to the extreme, to the upper end. This is about what are the core foundations that you need to make sure you're not missing out on anything on a day-to-day basis when your baby is developing. So when you're looking at zinc levels in a prenatal, 20 milligrams would be a minimum. A daily intake could be closer to 40 or 50 milligrams in some patients. Again, this is up to the practitioner who's looking after you to decide, but you'll likely have to, if you're going into more the upper realms, you might need to have an additional zinc supplement. But if you're aiming for 20, 25 milligrams, per daily dose or in your prenatal multivitamin, that would definitely serve you well.
Yeah, I love it. All right, so the part that everyone's probably been waiting for,
Yeah.
what brands do we recommend?
To just name it already. Yeah.
Not an exhaustive list is the first thing I want to say. Also, there's always new ones coming on the market, so we can only say what we're aware of and what we clinically use at the moment. So don't take this as if we haven't named the one that you have that we think it's bad. We just might not have looked at it. And as I said, not an exhaustive list. So I'd say off the top of my head, the ones that I most frequently use at the moment would be All Things Better Natal Support, which is an Australian-based brand by a fellow nutritionist, Catherine Hay. Yes. There's also another one that I often use, which the brand is MTHF Support, and it's called Prenatal Methyl. Also a really good option. They're both mostly like Australian-based. I don't know if they ship internationally. You'd have to look at that. In terms of for my kind of overseas international clients, one brand that I do frequently use, again, not an exhaustive list, is called Fullwell. And they're probably just 3 examples from my end. Are there any additional ones that you can think of that you commonly use in clinic?
Yeah, I do try and choose what's best. I do choose what's best for my clients, not try.
Sometimes I do, sometimes I
sometimes
don't.
I'm like, nah,
Depends
that'll
on
do.
the mood.
No, definitely not. So I just like to reiterate what you said. There are other good brands out there, and if we haven't mentioned it, it's not because we think they're bad. But what I find I most commonly recommend is one of 2, and usually either NaturBest, they have a trimester one with ginger. And I really like that because if you can get on the front foot with ginger, you kind of already got something on board to help with nausea associated with pregnancy. It is this is not necessarily a good or a bad thing, but it's a 2 capsule a day dose, which means if people are a bit sensitive with methylation, preconception wise, we can start on 1 a day and then build up, and we can check homocysteine and then make some adjustments from there. So that's a really nice option that I'm a big fan of. And Tressos Natal by Eagle is another one that I really like, and that's just a big chunky 1 a day one. But that one does have a bit of a classic B vitamin smell to it, which can be problematic, even if you're not pregnant, but especially if you are. So the NaturBest doesn't have any B vitamin odor to it at all. I probably lean on that one if I was to scan the landscape of what I recommend the majority of the time.
I actually sometimes use the NaturBest Preconception Multi for Men in my female clients because it has a much higher zinc, but there are then it's very person dependent,
of course.
But I also just thought I'd say that because the other thing I was going to add is that I also use prenatals more often as multivitamins than I do just a regular multivitamin. And I think sometimes people get confused my clients don't, because I explain it to them. But a prenatal is essentially just a multivitamin. It's just marketed differently.
Yes, and with some key nutrients maybe a little higher.
Yeah, exactly. Yeah. So, and it's not, I know this might sound obvious to some people to say, but I have had some people share this concern, so I'm just going to name it anyway. Taking a prenatal is not going to make you more likely, you, it's not
more fertile.
Yeah, it's not there's like an argument to say that it's improving your overall health. Your overall health improves your fertility, but it's not like taking it is it's like you've forgotten to put a condom on.
It's not the same.
No, it's very different.
There's a few other factors to get pregnant that have to occur.
Exactly. So
that's a good point, because I'm thinking of 2 clients I currently have on a prenatal, and neither of them are going to get pregnant, but one of them very sensitive to B vitamins, so the NaturBest 1 a day is just a nice like smaller dose of everything for her. And then another woman, again, postmenopausal, I'm like, don't freak out, it's a pregnancy multivitamin. It's just she gets really nauseous with B vitamins, so it's like a lower dose plus ginger, and I'm like, this could be your entry point to restore normal function to then be able to be more tolerant to other things. So good point.
It's good to name these things.
Yes.
Okay, well, I feel like that wraps up the conversation around the tips, some of the tips to choose a good prenatal, and hopefully that's been really practical for you. If you do want any further information on that whole preconception space, there's a couple of things that Amie and I have on offer. So from my end, and then I'll let you share what you've got available, I have a preconception guide called Sacred Seeds, and it is more of a comprehensive guide around helping you to prepare yourself for pregnancy, and it does go through a more extensive list of other supplements that I might suggest, as well as like food and lifestyle recommendations as well. So you can grab that from my website, or there's also a link in my Instagram bio. And you also have a free webinar, is that right?
Yes, I've got a webinar called Healthy Egg, Healthy Baby. And I do touch on some things around preconception nutrition, but also Graafian follicle development and nervous system regulation, and like circadian biology around that too. So
of course you do.
Of course I do. I mean, it's not a regular day that ends in Y if I don't mention blue light,
that's right? That's right.
So yeah, and that's free. So you're welcome to we'll put the link, all the links in the show notes, so you can grab those resources if you're in that season.
Amazing. All right, friends. Well, hopefully that's been helpful. If there are any follow-up questions to that, given it was quite a requested topic, if we missed the mark on something, just send me a DM, and depending on if I like your feedback, we might do might do a part 2.
If you leave us a 5-star review, we'll do another one.
Actually, like a bit of blackmail.
Look, bribery, is that legal?
I don't know.
You know what though, I'm itching to do a part 2, just quite frankly.
You're going to say I'm itching to do something illegal, and I'm like, we should talk after these cameras stop rolling.
I'm just so passionate about this, and I'm so annoyed that people keep getting prescribed shit
things that rhyme with Bellavit.
And on that note, friends, hope you
catch
enjoyed
you
the
next
episode.
time.
Bye.